Before we dive into the intricacies of monitored anesthesia care, let's first understand how it begins. The initiation of monitored anesthesia care, like any medical procedure, starts with a comprehensive preoperative assessment. This assessment is the cornerstone, helping tailor the anesthesia plan to fit the patient's specific needs and paving the ground for a pain-free surgical experience. This may sound like a concept straight out of a sci-fi novel, but in the dynamic world of modern medicine, specifically anesthesia, this is a tangible reality, made possible by Monitored Anesthesia Care, or MAC. MAC, a distinct and tailored anesthesia service, is specially designed for patients undergoing moderately invasive surgeries or diagnostic procedures. The hallmark of MAC lies in its unique approach of prioritizing patient comfort and safety, without the need for general anesthesia. Now let's delve into this innovative technique in detail. Monitored anesthesia. Care calls for a highly skilled anesthesia provider. This professional administers a precise blend of sedatives, analgesics, and sometimes local anesthetics to the patient while constantly monitoring the patient's vital signs and comfort levels. The unique MAC lies in this continuous vigilant monitoring. The purpose of MAC is to achieve an ideal level of sedation, permitting patients to stay pain-free, alert, and capable of independent breathing. The process is more than just giving anesthetics. It involves adjusting the level of sedation according to the needs of the procedure and being ready to act immediately if complications arise. Throughout the procedure, the anesthesia provider utilizes advanced, state-of-the-art monitoring equipment to continuously track the patient's heart rate, blood pressure, oxygen levels, and consciousness. This real-time analysis, facilitated by the latest technology, is what distinguishes MAC. The provider can make swift, informed decisions based on the instant data, thereby ensuring the patient's safety and comfort throughout the procedure. Concerning necessary equipment and expertise for monitored anesthesia care, it's essential to remember that it demands not just a highly skilled anesthesia provider, but also sophisticated monitoring equipment and a diverse range of sedatives, analgesics, and local anesthetics. In conclusion, monitored anesthesia care is revolutionizing the patient's surgical experience, ensuring it's as seamless, comfortable, and painless as possible by leveraging high levels of expertise and the most advanced equipment. Let's dive deeper into how monitored anesthesia care is performed. The process begins with a thorough preoperative assessment. The anesthesia provider reviews the patient's medical history, current health status, and any potential risks. This step is crucial to tailor the anesthesia plan to the patient's specific needs. Once the patient's profile is assessed, the provider administers a carefully balanced mix of sedatives and analgesics through an IV. The dosage and combination of these drugs are meticulously adjusted based on the patient's responses and the needs of the procedure. This approach ensures that the patient remains comfortable, pain-free, and breathing independently. In some cases, local anesthetics may also be used to numb the specific area being treated. This further enhances the patient's comfort without the need for deeper general anesthesia. But the provider's job doesn't end with the administration of these drugs. Throughout the procedure, they continuously monitor the patient's vital signs, including heart rate, blood pressure, oxygen levels, and consciousness. This real-time tracking allows them to swiftly adjust the sedation level or intervene if any complications occur. Furthermore, the provider also ensures that the patient's comfort level is maintained. They monitor signs of discomfort or distress and adjust the sedation as needed, ensuring a smooth, comfortable experience for the patient. In essence, the procedure of monitored anesthesia care is a testament to the power of personalized care. This meticulous, patient-centered approach ensures the patient's comfort and safety throughout the procedure, making the surgical experience much less daunting. Scene 3. Benefits of monitored anesthesia care. What sets monitored anesthesia care apart? The first compelling aspect is its ability to deliver a high level of personalized care. Through this method, the anesthesia provider has the flexibility to adjust the sedation level tailored to the patient's needs and responses, defining it as a highly individualized process. The second benefit is its capacity to lower the potential risks linked with general anesthesia, which include nausea, vomiting, and cognitive difficulties. It emerges as a safer option for older patients or those with underlying medical conditions. The third advantage comes in the form of quicker recovery time. Patients typically regain consciousness more alert and with less drowsiness compared to general anesthesia, allowing them to return home and resume their regular activities at an earlier time. Lastly, monitored anesthesia care is cost-effective. It employs fewer resources than general anesthesia and can be executed in an outpatient setting, thus reducing hospital stay and the costs linked with it. To summarize, monitored anesthesia care is a radical technique in the field of anesthesia that signifies an advancement in medical science. It offers patient comfort and safety, individualized care, speedier recovery time, and cost-effectiveness, ultimately making surgical procedures less intimidating and more patient-oriented. Scene 4. The future of anesthesia. As we peer into what lies ahead, the significance of anesthesia in healthcare will persistently progress, with strategies such as monitored anesthesia care paving the path. It's a captivating expedition of medical advancement, one that ceaselessly metamorphoses lives each day. Like every coin, monitored anesthesia care has two sides. While we've delved into its numerous advantages, it's equally important to shed light on its potential downsides. Firstly, monitored anesthesia care may not be the go-to choice for all surgeries. Specifically, it's not ideal for major or complex procedures that demand complete patient unconsciousness. Secondly, the success of MAC is contingent upon the skill and experience of the anesthesia provider. It's a fine art that requires adept hands and a keen understanding of patient responses. Thirdly, there's always a potential risk of undersedation or oversedation. Striking the right balance can be challenging, and if not managed properly, it may lead to patient discomfort. Despite these challenges, let's not forget that when administered correctly, monitored anesthesia care can still be a highly effective and safe method of anesthesia. In the next scene, we will dive into how to mitigate these disadvantages and ensure a successful MAC procedure. Given the potential challenges of monitored anesthesia care, it's natural to wonder, how can we mitigate these disadvantages and ensure a successful MAC procedure? The answer lies in a combination of skill, knowledge, and patient-centered care. Firstly, the key to any successful MAC procedure is the expertise of the anesthesia provider. The better the provider's understanding of the patient's condition and reactions to sedatives, the more successful the procedure will be. This includes a thorough pre-procedure evaluation, where the provider assesses the patient's health status, allergies, and previous experiences with anesthesia. Secondly, continuous training and skill enhancement are crucial. Anesthesia providers should stay updated with the latest research, techniques, and technologies in the field. This will help them handle any unexpected situations that may arise during the procedure. Thirdly, maintaining an open line of communication with the patient is important. Educating the patient about the procedure, what to expect, and how to communicate discomfort can enhance the patient's comfort and cooperation. Finally, the use of advanced monitoring equipment can help prevent oversedation or undersedation, ensuring the patient's safety. In a nutshell, while there are potential disadvantages to monitored anesthesia care, they can be effectively mitigated with the right combination of skill, knowledge, patient-centered care, and advanced technology.